We're here today at North Richmond Dentistry and we're talking to Dr. Steve Cross, who is using the OP3D Pro. Hey Steve.
G'day Sean, welcome to Hawkesbury Dentistry. It's good to see you out here in the country, New South Wales.
Yeah, it's a long way out, but it's always good to see you. Want to go through this particular case you've got, you took on the OP3D Pro.
Yeah, this is a very interesting case. This young lady had a wisdom tooth taken out about 6 weeks ago, and she's getting some recurrent pain in the 3/8 area. And the 2D image didn't show much at all. But we've got a 5x5 high resolution 3D image, and it shows you exactly what's going on. I'll just come over with me, sure and go on to see it. Yeah, so the teeth had a dehiscence in them. They were actually protruding slightly into the lingual space, and you can see where, as I move the slice around, you can see where the roots came through. Everything came out nicely, but she's got a sort of a lateral dry socket. Bacteria is getting on the side of the tooth, and she's got a low-grade infection. So we've got her antibiotics, and that'll be successful. But the point was, when you look at the 2D image, when you looked at the 2D image, this heavy bone here completely covered up the aspect on the lingual side, so it looked like normal bone. Once you've actually got the 3D picture, you can see radically how through and through lesion affected, even though this was packed with collagen, so we're giving it a chance to try and heal with antibiotics. If not, we'll go back in and cure it out. Then you can see the inferior alveolar nerve. Ian's well out of the road. You wouldn't want to come through on the lingual side because you know the lingual plexus is just there, so it gives you that accuracy when you're trying to repair a thing like this, to locate exactly where the curate is and where you're putting your graft.
So this sort of system's a great tool for general dentists.
Oh, absolutely.
Obviously.
Yes, absolutely, mate. This is a bit of a technical case, but within a blink you can see exactly what's going on. The 2D's a great lead, but the 3D on these more complicated things can show you exactly what's going on. I mean, I use this thing for broken roots, broken crowns, pre-prosthetic work, periodontal work, general practice stuff every day, and it's a tool I couldn't work without anymore.
Yeah, I suppose from a workflow perspective, being able to take the image at the time of consult is a big advantage as well.
Oh, absolutely. I mean, I think that immediacy of diagnosis and the immediacy of explanation for the practitioner and the immediacy of explanation for the patient is just a huge benefit. They don't wander off to get x-rays and may or may not come back. They've got an exact idea what's going on. If I do a single implant, I'll put it in virtually for them, and we'll work out a price and work out a treatment plan exactly, and they're happy when they leave with a little report, price of it. It's very conducive to good practice growth.
Great. Thanks for talking with us. Go well with the system.
Pleasure anytime.